Thank you for coming in to the interview and applying to be a team member here. Could you tell me a little bit about yourself?
Sure, my name is Dale. I've been a nurse for over 23 years. I currently work for the Department of the Army as a nurse case manager. And I saw your ad on the internet. I work with the spinal cord injury unit, and I think it would be a good fit.
Okay. I reviewed your resume, and I just wanted to go over a few things. You have been a nurse case manager for...
Well, I've been a nurse case manager by title the last 3 years with the Army. Before that, I worked in case management overseas. I totaled about 2,400 patients that I managed. A lot of care coordination, but as you know, care coordination and case management kind of go hand in hand. Before that, I was a case manager with the Army in Kansas. And before that, I worked in many different areas, as you saw on my resume. You have to case manage a lot of times and coordinate patient care. So all in all, out of my 23 years of nursing, I've probably been excelling in case management for at least 20 years.
What kind of education or certification would you have in relation to nurse case management?
Well, after I completed my bachelor's, I went back and got my master's with a focus in case management. As well, I'm currently certified as a case manager. I got my CCN. And the Army also has certified me as a master case manager and the certification process.
Okay. How long have you been in the area, and what hospitals have you worked at?
Well, currently I work at Fort Hood, and they have a whole network of hospitals, not only here in Texas, but also around the country and overseas. So patients coming and patients going. We work with all of not only the Army, but all of the Department of Defense hospitals, especially the major medical centers, because a lot of the folks that we work with have to go for treatment that we don't offer here locally. I also work with several of the local hospitals, King and Queens and Dana Scott and White, to utilize their services when it's cost effective, or if we can't get transportation to one of the military facilities in a timely manner, we use some of our local facilities.
Okay. What would you consider your biggest weakness?
My biggest weakness is being too nice. People try to take advantage of you sometimes, or sometimes people are lonely, or they're scared, or they're confused. Don't mind helping people. Don't mind at all. But sometimes when you're really, really nice, people call you for all kinds of things, sometimes unrelated things. Sometimes when you're busy with one thing, someone looks to feel that they can contact you and try to take care of some things that have some problems. And that's what we do as nurses. We're advocates for our patients. So it doesn't always bother me, but sometimes it puts additional workload on me. So that's probably my biggest weakness.
What would you say your biggest strength is then?
Goes hand in hand. My biggest strength is an advocate for the patients. Love patient care. Love helping people. Some people call it a job. This is really a profession and a career. Be nice to people and help people out when it comes around goes around. And just wonderful things happen for those that do rewarding things.
Okay. Why do you feel like you should be hired?
Well, I hope that my resume speaks for itself. I think it's very strong. I would really like to work with spinal cord injury patients that you guys have. Online, I saw the bio of all your staff. It just seemed like it would be a great fit. Wanted to work back in private practice and get away from government service. It was very appealing to me. And the benefit package that comes with the position seems to be extremely very, very good.
What challenges are you looking for in this position?
Learning the system that we work with here in this hospital would be really the only challenge that I have. I work well with other people. I work wonderfully with patients. I work across the entire region in case management, coordinated care, and services. So I don't think it'd be good much for challenge at home, except for day in and day out. So nothing overwhelming.
What would you view a work week to be for a nurse case manager?
Well, I think the position that you had was 7:30 to 4 or 8 to 4:30. Basically coming in, reviewing the panel, looking to see who's called, looking to who has appointments, coordinating with the physicians, getting any needed labs or ancillary testing results back to the physicians, coordinating insurance payments with patients. It just depends on the patient population. I'm not really sure what the patient panel size is per case manager here. I've had it as low as 30 with high intensity case management. I've had it as high as 2,300, doing a lot more care coordination and record reviews when it came to managing cases for learning. So anything in between is good. If I have any problems, I'll make sure that I let you know.
Do you expect to have a lot of face time with patients?
I expect to have nothing with face time with patients. I'm not trying to be the nurse manager, I'm just going to be the nurse case manager. So happy to let you run things and just work with patients.
Well, thank you so much for coming in, Mr. Dale. You'll definitely be hearing from us soon.
Thank you very much. Nice to meet you.